So, welcome back to MEDIMAGZA, the podcast where we connect you with the brightest minds shaping South Africa's medical and wellness landscape. Today's guest is Dr. Moratwe Masima, a medical doctor, mental health advocate, and aesthetic medicine professional whose passion for integrative health is truly inspiring. She is also no a stranger to the camera, of course, being a Miss South Africa runner-up. She's also a nominee for Rising Star of the Year in this year's African Health Excellence Awards. We're excited to dive into her journey, her advocacy, and her vision for the future of healthcare in Africa. Welcome to the show, Doc.
Thank you so much for having me.
Perfect. Doc, your career beautifully blends clinical medicine, mental health advocacy, and aesthetic medicine. What inspired you to pursue such an integrative approach?
I think that from young, or even just in high school, I knew that I wanted to integrate science and beauty in some sort of capacity. I've always had a passion for both. And I think that a lot of people tell you to choose one path and to just fit into one box. But I've always known that I'm quite multifaceted. I really have loved different aspects of just being, somebody that's a nerd, I would say, but also still really interested in other aspects of themselves. So I really don't deny myself from going for my passions, going for my hobbies, and that involves working in the beauty industry as well. I've worked with a variety of different skincare brands, and I think ultimately I'd really like to specialize in dermatology, and I think that that's where it all comes together.
That's fantastic. That's remarkable and truly inspiring. I think with just so much under your belt and trying to juggle all these things, it's quite fascinating. As a family medicine medical doctor, okay, how do you bring mental health and holistic wellness into your everyday patient care?
So in family medicine, I'm basically a general practitioner, but in the public sector. So it's a whole speciality where we really deal with everything from emergencies. I see pediatrics, I see chronic conditions like hypertension and diabetes. I also deal with anything trauma related, so gunshot wounds. I see it all. And
Yeah.
I think that it's such a beautiful field in medicine because it really keeps you on your toes and reminds you that medicine is ever evolving. I
Mhm.
always have to keep up with the latest research and evidence-based medicine. So I really enjoy that aspect because once again, I really do like learning about the science of medicine. I think that what really helps me stick to the mental health aspect is remembering that my patients are people. I think that I love the fact that I get one-on-one consultations with my patients and I'm able to really counsel them on their conditions, especially the chronic conditions like high blood and diabetes and even HIV. A lot of the times people really get scared with certain diagnoses, but I think that understanding the psychosocial aspect of the conditions themselves also helps patients manage them significantly better. So what I like to do is a holistic and integrative approach. So when I see a patient for the very first time, I discuss the medical condition, explain it to them as best as I can. I'll even pull up like Google images to explain what dyslipidemia is and how the cholesterol sits in the arteries because people really need visuals. They don't understand what you mean when you say that they've got high cholesterol.
Yeah.
And then I send them to the dietitian because a lot of the times people don't understand just how big something like nutrition and exercise can really play in their chronic condition. And
Mm.
on top of that, I really like involving family members and even friends just so that they are able to get that support at home because it's really difficult to start changing your lifestyle if you go home and everybody's eating, sweet things and dessert and you're left out alone. And I think that it's such an important thing to have that support structure. And for the patients that are really struggling with their mental health, we've got a lot of young people suffering from anxiety, depression. We've got a lot of psychosocial issues such as unemployment. I like to send my patients to see the psychologist or even the social worker because a lot of the times they really do need somebody to speak to and get psychotherapy.
Yeah, I believe that's so important because I also feel like when a patient does come in, because of stigmas attached to so many chronic conditions or just basic things like mental health or HIV. And with all the social media going on, they pick up so much fear that they sometimes are scared to disclose fully what's going on. And I think the only way you can help them is if you know the full story. So congrats on that one. You're a strong advocate for women's wellness and mental resilience, which is so important. What are some of the biggest challenges facing young women and professionals in healthcare today?
I would say there's quite a lot. I think just for myself as a young woman, I have found that I found myself really dimming my light sometimes. I thought I couldn't really be myself or actually advocate for the things that I really cared about, especially in the clinical space. So I worked as an intern as well as a community service medical doctor at both academic hospitals, really big academic hospitals. And as you can imagine, sometimes advocating for certain things can be looked down on. So I recall even being in obstetrics and gynecology and being quite shocked at the lack of analgesia, for example, for certain procedures. There's certain procedures that we do in gynecology, and there's not enough pain management. And I think that that's such an important thing that we need to advocate for our patients, to remember that yes, you as a clinician are seeing somebody that has a certain condition, but don't forget that that might be the one experience that traumatizes them for the rest of their lives. And I really empathize with those patients. And I think that from then on, I really wanted to be the voice for the women that are going through a lot of mental health as well as reproductive health issues that they might not get a lot of information on. I think that it's only now that there's a lot more information on things like fibroids and PCOS and hormonal imbalances. But before that, like a lot of women just suffered in silence. And I think that it's so important that we really do speak up about it because so many women actually just suffer and don't know what their real diagnoses are. I think what I also have noticed in just in practice as well is that as a woman in medicine, there are a lot of things that you might go through that you just need to keep under wraps. There's so many of my colleagues that, for example, suffered from medical conditions or were pregnant and they had to do a 24-hour call, have collapsed at work. And we also have to remember that we are also human. And at the end of the day, if we cannot take care of ourselves, we cannot show up for our patients.
I love that if you cannot take care of yourself, how do you show up for your patients? That's so, so important. How has your experience, okay, as a content creator and ProfMed brand ambassador shaped your perspective on health literacy and the power of digital platforms?
That's a great question. So I actually started working with ProfMed from the beginning of this year. We predominantly focus on creating health related content. So anytime there is an important awareness week that I will cover, for example, just recently there was Breast Cancer Awareness Month in October, and it was also Mental Health Awareness Month. So what's really important about the work that we do is that we go beyond just what medical aid actually does, which is, yes, covering you for any medical procedures or any emergencies, but actually providing you with the information and empowering you so that you know what to look out for as a patient and even just a general person. And what I love about this particular job is that, to be honest, I've been doing it all my life. So since medical school, I used to make YouTube videos, not just following my journey as a medical student and now obviously a medical doctor, but
Mm.
I used to disseminate medical content for the normal person just so that they could understand what certain medical concepts mean and what the red flags are. Because a lot of the times people truly do not know what is normal and what is abnormal.
Yeah.
So I was doing it out of the comfort of my own room. And it was so amazing when they contacted me and wanted to work with me to really just build the story where we are educating South Africans. And what's important about it is that I don't focus just on social media platforms. So yes, TikTok and Instagram are the basis of the content, but I then also speak to radio stations as well as television and just speak to different media outlets so that people can get the information a lot more easily.
That's fantastic. And I can tell you, knowledge really is power, and especially when it comes to your health. I mean, with
Mm,
MEDIMAG, for example, as well, we do a lot of I want to say educational features, and it's written by clinicians, but I think the general public is so thirsty for knowledge and also scared to ask these questions. So, posing the
Mm.
questions and then reading it and just gaining more knowledge is so powerful. Doc, you hold a postgraduate diploma in mental health, HIV management, and advanced aesthetic medicine. How do these specialities intersect in your practice?
So, to be very honest, it's such an interesting mix. And I think even when I chose to do my diplomas, I had no idea what I was doing. That is like the perfect answer because I think that they really encapsulate all my different interests. And I think that I go back to the very first question you asked me is that I cannot be boxed. And I think that my interest in HIV medicine really stemmed from my time in internal medicine. I spent time in internal medicine in my community service here, and I saw how much it really affects just the general South African population. And I think that it's such an important factor or side of medicine that we really need to be knowledgeable about as medical doctors. So I thought, you know what, let me go study further. And I'm really, really glad I did it. It was such an important diploma for me. And I think that it helps me every single day with my patients because, as I said, I work in family medicine and I see a lot of patients who do suffer from HIV. And then, of course, we've got the diploma in mental health, and that stemmed from my time in psychiatry, also in community service. I have always been an advocate for mental health. So I am somebody that already just like really struggled with anxiety all the way from high school. And I think that I just didn't have the tools to understand what anxiety was and also how to manage it, and let alone being an anxious person and also being a medical doctor. So I really wanted to understand my patients on another level, but also understand the science of how mental health disorders actually come about and how to treat them effectively. And I think it's helped me substantially connect with my patients and also understand their concerns because a lot of the medications we put people on come with really big side effects. And this is what actually ends up making people not take their medication. So it was really, really good that I did the diploma. And then at the moment, I'm still completing my aesthetic diploma. And I think that this really comes together with my passion for dermatology. It has taught me so much about I guess, the beauty side of medicine. But it's not all superficial because even in this particular diploma, we deal with conditions that a lot of people are suffering from. And I think that even just myself as a young Black woman, I see so many women who suffer from things like traction alopecia. We've got eczema, we've got psoriasis, and all of those are covered through the aesthetic diploma. And I think that it's such a great amalgamation of everything that I'm really passionate about. And I don't have a name for it yet, but I think that I guess I just practice integrative medicine. And so all of these different diplomas have really just taught me so much about how to treat patients well.
Just listening to you talk, I hear the passion in your voice and being such a multi-talent, I mean that's remarkable. So hats off to you, really. What role do
Thank
you
you.
think self-care and aesthetic medicine play in overall well-being, especially for busy professionals?
Mm. So I think I'm even still figuring that out myself because I think that in so many ways, when you are in the healthcare industry at any level, it's so easy for you to forget about yourself. It's so easy for you to put yourself on the side and say you'll get to it. I've got so many of my colleagues where we just say we'll go to the doctor until it gets too late and you've literally got no choice. And a lot of the times it's simply because of the system that we're in. We're so short-staffed, we're overworked, that we truly don't have the time to take care of ourselves. And I think that for me, self-care is non-negotiable. It's not a buzzword where I say, oh, I wish I had time to exercise in the morning, or I wish I had time to meditate. I take these things extremely seriously. In fact, I've made it part of my daily routine. I wake up in the morning and I'll meditate for about 10 minutes, and it grounds me. It helps me actually carry on my day and make the best decisions, and actually also keeps me calm in really stressful situations. I've actually noticed that since I've started meditating, I react so differently to even stressful situations such as resuscitations. I can think clearly, and I can remember things a lot more easily. Whereas before, I would be like, have a second of panicking and then only get into overdrive. So I think that it's one of those things where, as I said, self-care is not negotiable for me. It's really top of my list so that I can actually show up for other people in the best way. And then in terms of aesthetic procedures themselves, I don't necessarily believe that every people need to do aesthetic procedures. I think that they're just there for enhancement if you
Mhm.
do want to fix something. But as I said, it's so much more than just filler and Botox, which is
Yeah.
what people truly understand it to be. There's also like these really big sectors in aesthetic medicine where we're now dealing with weight loss treatments and how we're managing that with the SGLT one medications. And it's now only been introduced as like actual weight loss management. And I think
Mm.
that people really want effective ways of dealing with their own self concept. I think that we live in a very superficial world. We've got social media everywhere. And it's so important that we have healthcare practitioners that are educated on certain content and fields so that we don't get misinformation. And this is actually something I'm quite passionate about. There's so much information out there. It's so easy to just fall into getting content from people that are not educated on things, and it's quite dangerous, especially for young people that are on TikTok and watching influencers. We
Yeah.
need to have healthcare practitioners that are content creators or influencers because they are the people that are educated on these topics.
No, absolutely. Like I've heard so many people say, "Oh, aesthetic medicine. Oh, is it because you want to go into beauty and stuff?" And it's like, guys, it's such a vast field and it's such an open door to so many things that you don't understand what people are going through until, you actually hear them out. And it leads perfectly to my next question, and we both can maybe connect on this. So I was a Mr. South Africa runner-up a while back and also used it as an advocacy platform. For you, Doc, as a former Miss South Africa runner-up, how did that experience influence your voice as a leader and an advocate in healthcare?
I would say that Miss South Africa honestly changed my life, and it changed my life for the positive. So I think that a lot of people might think that pageantry can be a bit outdated or doesn't have its relevance anymore. But I don't think so. I really do think that it attracts people that want to make a difference, not only in their own lives, but in other people's lives and in their communities. And I think that I am somebody that really stood firm on everything that I spoke about when I entered Miss South Africa. I wanted to serve my communities. I wanted to be a voice for the people that were marginalized, especially because I work in communities where people do not have access to resources, let alone information, let alone education. And I think that Miss South Africa really just amplified my voice to speak about those things that I'm really passionate about. I think that it really also helped me find my voice and my passions a lot more faster because I stood on a stage in front of almost hundreds of thousands of people, even watching on television, and I spoke about what I really found to be really important. And at the time, it was reproductive health, because at the time we had really scary statistics on teenage pregnancy.
Mhm.
And my time as an intern at Joburg Gen really taught me how there's so many young girls that don't know how to protect themselves adequately. And that is what I wanted to advocate for. And fast forward 4 years later, I'm now quite literally doing that every single day. I work on platforms and I work with brands that have the same voice and have the same passion. And so I wouldn't necessarily be here if I did not do Miss South Africa. And I really think that it's something that has really developed my self-concept. I'm really proud that I did it. And I think that there's definitely a voice and there's definitely a platform for being able to walk on a stage like that and also still continue that work.
Definitely encapsulating there, saying beauty with purpose. Moving on to other
Yes.
accolades. Congratulations on your nomination for Rising Star of the Year at the African Healthcare Excellence Awards. What does this recognition rather mean to you?
Wow. So I was definitely surprised when I was nominated because I think that a lot of the times when you're just on go, go, go mode, you don't even get to sit with yourself and recognize what impact you've made or the work that you've done. You just work with deadlines and you're looking at all the different metrics. And I
Mm.
think that it's so beautiful that this work has been recognized because as I said, I don't have a word for it. I don't necessarily have a box that I or a category that I put myself in to say I'm a content creator, I'm a medical doctor, I'm a mental health advocate, I'm a women's health ambassador. There's so many different things that I'm interested in. And I think that saying rising star actually quite literally encapsulates it all together, that at the end of the day, I'm not just doing this just for myself and for my face to be plastered all over the place. It's
Mm.
coming from a place of wanting to educate and wanting to have empowerment for people because I think that it's so important that South Africans really understand their health. And it will really help move forward the next generation of people in South Africa.
Yeah, yeah. Speaking of next generation, looking ahead, what does your vision for South African healthcare look like?
Wow, that's a good question. I would say I would love for us to have more empathy. I think that medicine has lost a lot of the human side of it. I think that maybe me working in the government sector for such a long time, I've seen so many of my colleagues were burnt out. A lot of people just have lost that, I guess, that passion that got them in the field in the very first place. And I think that even with patients, sometimes they also don't have empathy for healthcare workers at the same time because they're also frustrated. They've got long waiting times, long queues. They get to see the doctor, they get to see the nurse, and they're told that there's no stock of certain medications or they don't have anything. And I think that that's what's missing right now. Is I think that a lot of people are frustrated. So would really love for us to bring back empathy, but also that would come with having certain controls and systems in place to prevent, the loss of resources and for us to actually get back the purpose into medicine and the financial injection that we need.
Yeah. No, everything you've said there is a spot on, and I completely agree with you. So here's to the future of healthcare in South Africa. And well, that wraps up our show. Thank you, Doc, so much for sharing your journey, your insights, and your passion for integrative healthcare with us. We wish you all the best in the African Healthcare Awards this year for that Rising Star Award. And we look forward to seeing you again and catching up with you. Thank you so much for being on MEDIMAGZA, the podcast.
Thank you so much, Clive, for having me. It's been great.